Happy Chinese New Year to the global plastic surgery residents. This is your host for tonight, Edward Tung, from the American Society of Plastic Surgeons International Resident Forum podcast team. This podcast is an official platform directly organized and supported by the American Society of Plastic Surgeons, created to spotlight global voices in plastic surgery. It is a place where we share your life stories, your professional journeys, and the issues, challenges, and concerns you believe deserve to be heard in our community. We are proud to announce today is our last episode of the third podcast series, which provides comprehensive exploration of aesthetic surgery training. Throughout episode 11 till 15, we have gone through aesthetic training around the world, training in resource constrained environments, global case sharing, and strategic pathways for aesthetic surgery training, personal growth with ASPS. Series 3 really focused on how to get the young plastic surgery residents started for the journey of aesthetic surgeon's life. I do hope that if there's any suggestion or improvements for our podcast series, please feel free to reach out to us at ASPS podcast team at gmail.com. Today, I'm deeply honored to introduce our guest speaker today, Dr. Luis Gerardo Sandoval, for our final episode of the Series 3. Dr. Luis Gerardo Sandoval is the current ASPS International Young Plastic Surgeon Forum Chair. Dr. Gerardo Sandoval is also a board certified plastic surgeon with international training, specialized in facial, breast, and body cosmetic surgery. He has received his residency at the University of Peruna Cayetana Heredia and completed international fellowship with ISATS in Rotterdam, Netherlands. Today, he is also the PRS Global Open Peer Review Editors. Dr. Luis, can you please introduce yourself to us?
Edward, thank you for having me tonight. I am Dr. Luis Gerardo Sandoval, a board certified plastic surgeon from Peru. I train at Hospital Nacional Cayetano Heredia, which is high volume academic institution with very rigorous surgical exposure. The pathway to plastic surgery uh, has been amazing because here in Peru we have very spots for academic research and always try to give our best. So right now, thanks to that, I am board certified in my country, and also thanks to ASPS, I am chair of the International Young Plastic Surgeon Forum. This has been a great pathway in my career because I always have the support from the ASPS since the beginning until now.
Wow, that's really amazing. Like, so since today is the grand finale for season 3, I hope today is like the most important podcast for people who wants to be the aesthetic surgeons. And we are offering the direct resources and materials from the ASPS community through Dr. Luis Gerardo. Can you first start with how did you first get your aesthetic surgery training in your career? Like, did you learn it through your residency, or did you learn it after you completed your residency at like a clinic or multiple facilities?
I will say it started gradually, but intentionally. During residency, most our formal training focuses on reconstructive surgery,
Hmm.
which is extremely important because it builds anatomical discipline. But from the very beginning, my mentor, Dr. Ricardo Gomez Galindo, told me something that changed my trajectory. He said that he did not have early exposure to aesthetic surgery training during his training, and that with me it will be different. And from the first week of residency, after hospital duties, I will accompany him to his private aesthetic cases. So I had this dual exposure, reconstructive surgery during the day and aesthetic surgery in the evenings. So that shaped my mindset early in this aesthetic career.
Well, was that like a professor at your training facilities?
Yeah, he's the director of the plastic surgery residency in Hospital Nacional Cayetano area. So in the hospitals, we only make reconstructed cases. In the night when we finish our duties, he allowed to join him in his aesthetic cases. So since the very beginning, I was exposed to the aesthetic career.
Well, that is like really great for you because like I don't know, like I don't know if this is like the same for throughout the whole world. Like I don't know how it is like in Peru because in a lot of training facilities in Taiwan, they don't really like the residents try to get too much knowledge about like the aesthetic training, mainly because they feel like either because you will go out to do your own business with your own marketing, and also because they feel it is less related to educational path. I feel like was your training in your facility like the environment and also in Peru society, were they all very supportive for residents who want to perform aesthetic surgery?
Yes, in Peru, we have like a 6 to 7 spots to plastic surgery programs. Uh, we are about 4 plastic surgery programs, and in all 4 plastic surgery programs, they allow in their free time be exposure to aesthetic training. That's many mentors, or right now many the mentors in the Peruvian society, when they were trained in aesthetic surgery, they were only trained in reconstructive, and then after when they finished their residency, they started their aesthetic career. But right now, hopefully, the things are changing, and I think that almost all plastic surgery trainees in Peru are exposed to aesthetic training since the beginning. So that's very important because in Peru, is a very popular country for body contouring and breast aesthetics. So that's the reason why I think that all the residents here are exposed to aesthetic training since the beginning, but always in their free time. So, for example, we enter in the hospital at 5 a.m. or maybe
Yeah.
6 a.m., and then in the afternoon, 5 p.m., we can access or we can join to our mentors in their facilities. So that's I think that is very important because if you are training since the beginning in aesthetic procedures, when you finish your residency, you are more confident to do that. I think that early in any career, you need to balance passion with responsibility. I think that it was naturally to drawn to body contouring and breast surgery because we do a lot here. I think that at least uh, we had 1 to 2 surgeries in the afternoon, and one of them was about breast or body contouring. So those procedures combine anatomy proportion and as an artistic judgment. And when you are trained also in reconstructive surgery, you know that is experience, and you can expand it to do more procedures in the future.
Since you brought it up about how Peru is like specialized in body contouring, and you also mentioned about breast, like I'm wondering if those two procedures were what you were favorite and interested in, and if not, like if other procedures, like could you also get trained after the 5 p.m. session, and also if not, like where else would you get trained in your career path?
Well, that's a great question. In our region, body contouring is extremely popular, as I said before, especially liposuction, high definition contouring, and breast surgery. I think that breast surgery remains very consistent in demand. And in my training, I was only had exposure to rhinoplasty and blepharoplasty, but not facelift, because we had on Wednesdays reconstructed cases for example, we have a lot of cleft palate rhinos, or maybe traumatic rhinos that people who had accidents before. But in facelift, we didn't have too much training. So when I finished my residency, I think that I was thinking about how can I complement my training, because I only had experience in reconstructive facial procedures, because we did a lot of reconstruction facial procedures, but not aesthetic procedures. So when I finished my residency, we were allowed to apply to join maybe a clinic to get more involved in facial surgery. But when I finished my training, I had the opportunity to apply to a fellowship, and I applied to an ISA fellowship, and I get the opportunity to go to Rotterdam.
Mm-hmm.
So I had in Rotterdam very big exposure to facial and breast surgery to complement my training in Peru. So when I finished there, I think that I was involved in all procedures that I need, and
Wow.
then I moved after to Peru. I was in the hospital 6 months, and then I started my own private practice until now, that I'm happy to do it the way I want.
Well, I think what you just mentioned really brought up a lot of like interesting questions that I would like to figure out. Like, of course, like the first one is like, um, do you need to be so well rounded in different aesthetic procedures as a aesthetic surgeons? Because right now, as a young resident, for me, the way I'm not so exposed to all these procedures yet. Like the way how I imagine it is that to be specialized and be good and be famous for a particular surgical procedure, it really requires maybe 100 or maybe 1,000 procedures for you to become good, but everyone only has like 24 hours, 7 days a week. Like, so if we try to specialize in the breast, the facelift, and also the body contouring, like, are we able to be as good in all of this? So should we be a well-round trained plastic surgeon, or should we just try to target one or two areas? Like, I think you are specialized in breast and body contouring. Is that what you focus on right now, or do you still do all types of different surgical procedures?
Well, right now, I have 80% in body contouring procedures, including breast,
Mm.
and 20% is uh, mainly rhino and periorbital rejuvenation or facelift. When I started my own practice, uh, for example, I had the best advice ever. If one of my mentors in the Netherlands, Jeroen Stevens, told me, "What is the best advice to give you as a young plastic surgeon? First, you have to do the best cases as you can. No more quantity, more quality. If you are starting, just start with one case per day and give
Mm.
your 5,000%, not 100. 5,000% is like a for that patient." And I
Wow.
started with that. For example, I started with my first case as a private practice was rhinoplasty. Always study the case first very well, see the best scenarios, and make your best case, because you are getting you are when you started, you are a young plastic surgeon that is not famous in your country. You have to be famous for your cases.
Yeah.
So when I started my first cases until now, I operate only one patient per day. So I operate mainly from Monday to Saturday, and I give the best with my patient. For example, I have body contour, liposuction. It takes me about 5 to 6 hours. I stay with the patient after the surgery, and then in the recovery time, and then I am in every aspect of the recovery. So I think that all the patients that you are making in that time, they recommend you to other patients, and then when you when you are thinking about it, It's all the little work that you are doing with each patient each day. So I think that the best advice I can give you, every young surgeon, is that when you are starting, give your best. And then you will be focused on more procedures in any particular topic because all your patients are recommending you, or maybe Luis Gerardo give the best breast or maybe the best body control procedure, so they are coming to your practice and dedicate time is important. And this, all of this is about quality time. You don't have to be desperate for get more patients. Try to give the best with each one because each patient is a whole new world. So with that, I think that when I started my practice, I was in the correct way to do the best things that I can. And I think that this advice was the best because right now I have uh, I have my agenda full until March. So this is because I try to give the best with the patients in each step of the process.
Well, I think like that's a really powerful advice. Like especially it's right connected to what I hope to understand for like I understand that plastic surgery specialty is almost like the only specialty, or apart from I guess dermatology, that is really specialized and in aesthetic surgery process. Like in our training, throughout our residency, there's just a lot of like about beautiness in the training programs. And I'm wondering, like when you start your aesthetic training process, like had there ever be a complication or unexpected surgical outcomes that happened to you? And I'm sure that what you mentioned about this powerful advice will really decrease the amount of complaints from the patients, because you spend so much quality time with the patient that like you can really understand what is in their mind, what they want for their appearances. And so I guess less complication would happen. But had there ever be a complication or unexpected surgical outcomes that happen, and how did you manage it?
Yes, I believe that any honest surgeon will say the same. Everyone can have complications. I have complications. So I remember that I have when my first complication case was with a facelift. I have a big hematoma.
Oh.
And I remember when I was in my training in the Netherlands, we had the same situation with my expert mentor. So in that time, I stay focused always. The reason that I will stay with the patient is because the hematoma was in the postoperative period. I entered again, I resolved it, and then I was in the patient in every stage. And right now, this patient is the best patient that I have because she always recommends me to everyone. And she knows that I have this complication, but I started to explain since the beginning, since the pre-op consultation. Because when you are planning the surgery, you have to be honest with your patients and tell it that in any surgery can have complications, but you are in the capacity to resolve it. I think that when you are very meticulous in each step of the process, you can have the best eye to see early complications or any complications and try to resolve it in the beginning. I think that the real test of a surgeon is not the perfect case, it's how you manage the imperfect one. So you have to be meticulous planning because biology can be unpredictable. So early recognition, transparent communication, and staying present, this is important. Never disappear from a complication. I always document any case. For example, in body contouring,
Right.
48 hours before the surgery, I take the pictures. Always pictures in the
Mhm.
same position, with the same background, in the same distance. I always make the drawings before, and I make videos of the drawing. because this is my plan before the surgery. And when I had in the surgery, I have pictures of my patient, so I can see things that I cannot see when the patient is in the bed in the OR. So I think that it's important that in aesthetic surgery you have to manage expectations because it's as important as managing tissue. So when complications are handled ethically and responsibly, patients often appreciate honesty and accountability. So trust is built especially during those moments.
Wow, that's a really, really well said, like really well knowledge for the global plastic surgery residents. I think what Dr. Lewis really coined down is that, the key is to stay in touch with the patient and to give the quality care in every step so
Yeah.
that when we meet the complications, it's inevitable, but it's how we manage it that really present to the patient's comfort. So, Dr. Lewis, like I like to ask, like I think what you had was a very fortunate route, since not just in your residency career you were exposed to a great mentor during your training career, but like after your training career, you also went to Rotterdam for the fellowship. Like, but I think most of the residents around the world don't have a mentor or a training facility that help with aesthetic training like yours. So since this episode is designed for us to find mentors in aesthetic surgery training in SPS, can you first start with like how did you first get involved with ASPS?
Yeah. I started proactively. I started when I started my residency, I didn't know anything about ASPS, only the name, you know. And I have the opportunity to get the first involvement with my mentor because you have to enter to the SPS and you have to send an email. And then I met Romina Valadez, who is in the podcast. I think that she's hearing right now. So she introduced me to enter to SPS when we had a meeting here in Peru. So I think that attending meetings, submitted academic work, and connected with colleagues was the first starting point with the SPS. I didn't have in my training organized a method of learning because we have any case every day. So when I entered to the SPS, Romina told me about resources, and I entered and I met the Resident Education Center, that is a free platform for any member of the SPS. So in the rec, you have all the modules of all your training in plastic surgery. You can have resources like video, cases, questions. So I was encouraged to read all the modules, and I think that with that was my first entering point to the SPS. And then I have free access to the PRS journal. And then over time I was involved into leadership roles. So I think that ASPS offered a structured academic ecosystem when research, mentorship, leadership pathways. I think that align with my long-term vision until now. And
Wow.
then in my last, I think that in my last months of residency, we had the opportunity to get into the first international residencies World Cup that hopefully we won, and that was amazing because we use all the resources of the SPS, so it was amazing experience.
Oh, since you mentioned about that, can you like? I think this sounds like a very meaningful and inspirational experiences. Like, can you tell us how you managed to have your SPS involvement with the uh, experiences, and how did you like extract the resources that you need to for your personal growth?
Well, I think that the rec or a resident education center is important to any residents or bueno, any plastic surgery resident in the world. You have everything in that platform, and then you have courses you can have for
Mm.
free, and you know you can get access all the meetings from the ASPS in a few price in low cost prices when you are a resident. So you have to have any take advantage of all of that, because when you finish your residency, the prices are for plastic surgeons, so it's more expensive. But when you are a resident, you have access to everything. You can send an email to an expert in the SPS, and he or she can answer you in I think that in less than 1 week, and you can get access to be a reviewer if you want, or maybe you can get all the access to the PRS journal. You know, when I was in the first meeting uh, from the SPS, I was in the virtual setting. I don't was I wasn't in inside in plastic surgery the meeting my first time. I
Huh.
was only virtual, and you have always on demand access to all the lectures, so you can take advantage of that. Because when I was training, I was always seeking about all the experts to try to get more information about all the procedures that I was doing in Peru. So when I was in the meeting, in the virtual meeting, I was always focused in, for example, fascial reconstruction, body contouring with Alfredo Hoyos. I first met him in virtually in his lectures with Rock Rorick. I always see, I always saw all his lectures, and then when we had cases in rhinoplasty in the hospital, I tried to give the best, and I tried to do. And for example, in that time, he published a paper when was the fourth step a process to do a spare flap in rhino. So I think we had one case per rhino in that time in each week in the hospital. So I read the paper, I present in the academic setting because we always had to present our cases before the surgery. So I try to do that with the patient, with the help of my mentor, and this interaction in virtual setting with in person was very, very, very good for our understanding and then for our learning. So I think that when you integrate everything, even if you are in a low resource setting, you can take advantage of everything and you can be a better surgeon. Always guided with your mentor, with a plastic surgeon with more experience, because you cannot make damage to the patient. So always try to do your best with ethical and always communicate to your patients that you are a resident and you are taking the case. In Peru, we have, I think that almost 90% of the hospital are um, hospitals make for teaching, and I think that every surgeon in any specialty in Peru, even if they are visiting from other country, they can access to hand-on experience with patients, always in the hospitals dedicated to docency and residency.
Wow. Hmm. Wow. That's like really, really good like resources that you have. It's like I feel like everyone is very open for education and teaching others in Peru. Um, I want to ask like how, since I think for many residents when they first approach the ASPS would be like a frightened person. And I can see that you are the hungry wolf. Oh my god! Like you see almost every virtual videos, and you try to you know what you want, and you harvest what you want. So I want to know like how was your experiences with the professors and mentors with the ASPS? Like were they easy and approachable, or at first because since you didn't know anyone? And
Well,
also before you answer that, I also want to mention to the audience that ASPS has this program called the Propel Mentorship, and I'm proudly to say that Dr. Lewis is my Propel mentor, and he had actually gave me this lecture about he as my mentor for the first time we met. It was very eye opening, and I'm wondering if you can also share your story with your mentor in Propel as well, and the lesson that he gave you.
Well, Edward, I am really honored that to be your mentor first,
Oh,
because
thank you.
I was also a mentee before. I was when I get involved, I applied to Propel program when I was in my second year of residency, and then we have like a one mentor from Dr. Rock Rorick
Yeah,
was one of my mentors, not in Propel. In Propel was I don't know if you know Dr. Steve Cohen, Dr. Bias.
yeah,
Yeah, so they were in the group of mentors, and when we get reunions, I was always asking, what is the best advice that you can give me as an international plastic surgeon? So always they answer almost the same. Take advantage of everything when you are resident, because you can ask any expert. You can ask any to any plastic surgery resident, and they always will be open to give you advices. So I started to do that. When I was in a webinar, I always ask for the email or maybe the number to make some questions. I started with Rock Rorick. I was in a meeting with him, and he sent me his book from the USA to Peru. I had his original book because it was a gift from him. And later on, years after, when I met him in person, I told him about it, and he was very humble because he told me that I am open to give everything when residents ask. You only have to ask. If you want to be the best, seek the best. If you want to be a good surgeon, always stay humble and always uh, take up advantage in the sessions, in the meetings. Don't hesitate to ask. Don't be afraid to ask. So when I right now until now when I am in any meeting, I always try to ask to the experts. I always try to show my cases. So I think that Propel was very good to me because I didn't have this program in Peru. My mentor was my professor, but I was very insecure to ask because I don't know when you enter to plastic surgery program, you see all the giants in plastic surgery and you think, oh my god, they are so far away from me,
yeah,
and if I met them, I don't know what to ask. So
yeah.
propose give me the tools to don't be afraid first to get involved with any expert. And I said you in the first meeting that we have,
Yes,
don't be afraid to ask. I try to share with you, you know, some tips that I think that is important after your through training. But I think that always it begins with asking to any expert that you have. I think that with any plastic surgeon who is asking who is being asked by any mentee or any resident, I think that they are always happy to answer. So don't be afraid to ask, and don't be afraid to take mistakes, to have a mistake, because always anyone was born being an expert. I think that in this long, beautiful way career in plastic surgery, I think that it's very important that um, You don't have to be afraid. You have to always try to give your best, even if you take mistakes, because we learn more from mistakes than anything.
Yes, thank you so much, Dr. Lewis. That was the most inspirational thought. Like, it's like you show me how you were. The thoughts is just the same as me. You were afraid as a young resident, and look at you now. You have grown into the chair of the International Young Plastic Surgery Society. Like, I think this dramatic change really shows that you were one of us before, but you succeed to where you are now. And since we are coming to the last section of the podcast, I really hope that as the leader in the Young Plastic Surgery Society, like, can you give us some brief introduction about this coming up Global Plastic Surgery Congress in 2026? Like, what is so special about this event? I think this is the first year of the Global Plastic Surgery Congress.
Well, this Congress represents a bridge between continents and generations because it's the first Congress that is outside the US and organized by the ASPS in conjunction with the SACPER, the Argentinian Society of Plastic Surgery. It's the first of its kind. So I think that as a
Mhm.
chair of the International Young Plastic Surgeon Forum, I try to create a program where young plastic surgeons in South America, North America, and Europe, I think that we are making a very beautiful program, and will be the international women plastic surgeons, and also the international residents forum there. So I think that with all the master classes, with all the experts, will be a huge congress and one of its kind. I think that the future of plastic surgery is collaborative, so this global congress will be amazing. I think that the goal of this congress is uh, to form a structured global platform where young surgeons and also plastic surgeons who have a big career feel supported academically and professionally. I think that ASPS offers everything right now: scholarships, observerships, mentorships, program like Propel, leadership initiatives inside the meetings. So the resources exist, but for all the plastic surgeons over there that are hearing us, or maybe the residents, you have to be proactive. And I invite every resident, every plastic surgeon in the world to attend the Global Plastic Surgery Congress because the program is huge. Will be
Yes.
experts from around the world, and you will enjoy Argentina. I think that you have to if you can, you can go there because will be also an international residence World Cup. So will be amazing to have and to see all the future plastic surgeons compete each other and make relationships because it's important to make connections.
Yes. Yes. Yes, thank you so much, Dr. Lewis, for sharing such profound insights on professional development this morning. These perspectives are invaluable to the global plastic surgery community, particularly for residents navigating the complexity of their early careers. Without such structured guidance, many trainees may find themselves navigating their professional growth without a clear strategic roadmap. It is our sincere hope that this podcast series serves as a catalyst for international collaboration, fostering increased engagement, scholarly communication, and global networking. Remember that potential mentors and role models who can significantly reshape your career trajectory may be just across the globe, waiting for your initiative to connect. Thank you very much for Dr. Lewis, the International Young Plastic Surgeon Chair, who has shared such profound knowledge on how to be the aesthetic surgeon in ASPS community. And we will be very, very excited to meet him at the Global Plastic Surgery Congress at Argentina. Thank you very much. Please contact us at ASPS IRF podcast team at gmail.com if you have any concerns or stories to share. Thank you very much.
Thank you very much, Edward, and thank you to all the ASPS team to having me here as in this incredible podcast. I truly appreciate the opportunity to share my experience today. I'm coming from Peru, training here. I learned that aesthetic surgery is not about technique, it's about responsibility, mentorship, and continuous growth. And global collaboration has changed my perspective. I always say thank you to ASPS because ASPS has reinformed something very important, that excellence is intentional and it requires discipline, humility, and structured education. And from young surgeons listening and from all the residents, I will say this: seek mentors early, stay academically grounded, invest in education before investing in equipment, and remember that your reputation will always follow your contribution. And the future of aesthetic surgery and plastic surgery is not isolated, it's collaborative, structured, and global. Thank you to the ASPS and everyone listening for building a stronger international community together. Thank you.
We hope you enjoyed this episode of the Enhance Your Practice podcast series brought to you by ASPS University. You can listen to our other episodes on any of the podcast platforms where they are currently available, or you can download recordings directly from ASPS EdNet. New seasons and episodes coming soon on practice management. Please contact ASPS Education with your feedback and suggestions for future podcast topics. Thank you for tuning in.